Hi, and welcome to our training for suicide risk assessment teams and school-based mental health providers. This training has been created for you and follows Virginia's suicide prevention guidelines for Virginia public schools that were adopted by the Board of Education in June of 2020. Today, you are joining us for part 2 of this training. My name is Martha Montgomery, and I'm the school psychology specialist in the Office of Student Services at the Department of Education.
Hi, and I'm Sarah Bazemore. I'm the school counseling specialist and student assistance systems coordinator in the Office of Student Services, also here at the Department of Ed. Thank you so much for joining us. So as Martha already explained, we're in the part 2. Hopefully you have viewed part 1 already, where it speaks to prevention. And now we're going to talk about the intervention. So this is really where, there is a concern where a student is showing signs of suicide and what needs to take place. Again, I apologize if this is redundant, but these 3 modules also follow the outline of the guidelines, which goes from prevention, intervention to postvention. Also, just a helpful tip, you'll see throughout the slides, and you have access to these slides. They are provided to you as well with this module. You'll see a light bulb, and when you see a light bulb, that is going to be a link to a resource that should assist you with whatever topic the slide is speaking to. If you see the pencil icon, that is going to be a link to an example template or form that you can use as is, or you can tweak and create to fit your school's needs. And so again, I just want to reiterate that the forms and templates that we suggest here are not mandatory. They're just, basically things that you can use to either tweak the forms that you already have or that already exist within your school if they're working for you, or if you feel like you need to replace. Obviously, feel free to use these as you see fit. So now we're going to roll into that intervention piece. And basically, the whole point of our intervention is to make sure that students recognize that there's help and there is hope. We want to foster that in every interaction that we have with kiddos during this crucial time. And I can speak to in the field, when as a school counselor, this is one of those times where students are at their most vulnerable moment. And it is such an honor to be able to be present with students during that time. And there really is no other priority bigger than that. So that's just so crucial as we move into this, is to just remember that we play such a pivotal role in that intervention piece as counselors, school psychologists, school social workers, making sure that we are keeping that at the heart, that we just really want to instill with our students that there's help and there is hope. And in making sure that every interaction we have with them during this phase, that message is sent. So I like to have kind of a broad overview of things before I jump into the nitty-gritty. So I thought it would be helpful to sort of show you this, outline or flow chart of the intervention process before we jump into each of the phases. So you can find this outline or flow chart on page 29 of the guidelines. And I would suggest even printing it and having it in a place in your office that you can refer to. It's so nice to have a visual representation of the process while you're going through it, because, it's a stressful time for all of us. And you want to be able to have all the tools and all the resources you need at your fingertips. And this would be a helpful one to have access to in that moment, and not have to try to flip through pages or find it on your computer. It's just kind of to streamline things. So we're going to start by talking about that student of concern is identified through whatever referral processes you have set up in your school. And we talked a little bit more about that in the previous presentation. It rolls into that student interview, which is so crucial and important, assuring that student safety and that parent contact or guardian contact that occurs, gathering of information, moving into that team consultation. And we know that looks different at different schools. So we're going to talk about some of the basics that need to be in place for that to be successful. rolling into safety planning, and talking about what you do to support the student moving forward. So first, just identifying that student of concern, being ready to catch, when a student does present, either because they've been referred by a peer or a staff member or their parent, or they've self-referred, just making sure that you have that process in place to implement the risk assessment in a streamlined way. So first, just making sure that everyone knows that the student should be initially escorted to a private place. Now, if you're in a virtual setting, we know that that's going to look a little different. We're not necessarily physically escorting students, but if a student starts to disclose information in front of other students, either in a virtual setting or maybe in a classroom setting, that we do what we can to protect their confidentiality and their privacy, and we either dismiss students or we take that student and escort them to another location. The important thing here is, regardless if it's virtual or in person, is that we do not lose connection with the student. They are constantly supervised. So you're not saying, you know what, we're gonna hang up or disconnect and I'm gonna call you back on a private line. You're not saying, can you walk yourself down to the school counseling office? Someone is staying with that child and keeping their eyes either virtually or in person on them, so that we know that they're safe. So, and that should happen as quickly as possible. It doesn't matter how minor you think that risk could be. We all know that sometimes teachers will kind of have a sense that something's going on and they're not completely sure if there's a risk of suicide, but they suspect that there might be. That still requires that immediate attention, because we know that a counselor could get into a conversation with a student or a school psychologist or a school social worker, and it could develop into something more. So we don't want to wait until the end of the day to start investigating these things. So as soon as you have a concern, it needs to be immediately addressed. The school administration should be notified that a suicide risk assessment has begun. However, they're not necessarily going to be directly involved in that student interview process, but it's helpful for your school admin to know that that has begun, so that they're kind of on cue and ready to jump in as needed. And then every school division needs to have that policy in place for what to do if referrals are received outside of school hours. So if a school counselor gets an email or a teacher receives something through their online platform, what are they to do in that moment when you don't necessarily have all of the resources at your fingertips that you would have in the school setting? So the student has been identified, and now we're moving into that student interview piece. And this is not a fun conversation to have with a kid. Let's just go ahead and put that out on the table. It's uncomfortable to ask them some of these questions, but it is so important that we do, and that we do this interview well. I know that I always have to take a deep breath before I directly ask a student if they are thinking about taking their life. And the way that we phrase that question is so important. And we've talked so many times about this as a school-based team before, about saying something like, "You're not thinking about killing yourself, are you?" How that is not the right way to phrase that to a student. That again is building onto that stigma and possibly making them feel ashamed if they are. So really thinking about the questions we're asking, role-playing, preparing ourselves, so that when we're in that moment and our emotions are high, we're ready to respond to the student appropriately. So one thing we also need to make really clear is that the student interview is something that should be conducted by someone who is trained to do so, which means they are a mental health practitioner. So a school counselor, a school psychologist, school social worker, those are the folks that you want doing this interview. And I know that a lot of my administrators in the past have wanted to be part of those interviews because they care so much about their students and they want to be there and they want to hear from the student directly. But we really, really urge and plead that does not take place. Administrators, even they can be the most relationship building administrator there is and wonderful people, but that title itself comes with a stigma that could make it so that students don't feel as comfortable to disclose if a school principal is present. So we ask that the interview be conducted just with school-based mental health practitioners present, and that includes teachers as well. Teachers should not be part of the interview either. You know, there are special circumstances, and we know that, so it can get a little tricky, but typically you would not want a teacher or an administrator part of this process. Another big piece of this is that collaboration and consultation. We need to make sure that, you know, perhaps I might be the only school counselor in the building at that time, and my school psychologist and my school social worker, it might not be a day that they're with me. So it might just be me conducting the interview, but this shouldn't just fall on me to process it. So maybe I'm calling my school psychologist, or I'm calling my school social worker, or I'm connecting with another counselor in another building to talk about what I've learned through the interview and to process that together. What's great is if you can have another school-based mental health person in the interview with you, so that there's two of you asking questions and that you are both hearing that information. But we know that sometimes that's just not possible, and we wouldn't want to delay the process of interviewing a student because we have to wait for that second person to come. So just err on the side of what's best for the student in that moment. And if it's possible to have two folks present, that's great. It's also important to note that sometimes we hesitate to talk to students directly about suicide because we worry that if we talk about it, we're going to increase the likelihood that they would do that act. And research shows that is not true. It's better to go ahead and open that door, to go ahead and have that conversation honestly and frankly with the student. That is going to be the most preventative thing that you can do. So don't hesitate to do that and to ask those direct questions, but also be considerate of a student's religious belief as well as their culture. So when we're talking about something as big as death, right? That's really where this is going. You're going to have students that are going to disclose things to you that align with maybe their cultural or religious beliefs. And this is a time for us as professionals to not reflect what we believe onto students, but instead for us to be listening and accepting what they believe. So just to be really mindful of that and careful in our communication. So I think the student interview it's almost could be a training in itself. So I apologize, this is somewhat succinct, but just make sure that you've really thought out how you want to approach it. You know, having some questions out that you want to make sure that you're ready to ask, and you know, just being prepared to again, you know, circling back to making sure students know that there's help and there's hope, but also the student interview is a time to really gather information and to assess that risk. So, and Martha, did I forget anything? Is there anything you want to add to that? No.
Oh, that was great. And as Sarah mentioned, with the student and for the school-based mental health practitioner that's doing the interview with the student, this is a really scary time for parents as well. And so we want to make contact with parents the same day that we do the interview. And really the first thing that needs to be said is to assure that their student is safe. Because hearing that their child is at suicidal risk, it can be shocking, can be scary, and parents don't always know how to react to that. So you want to assure that the student is safe. The other components of the parent contact are you want to report where the suicidal risk came from, what signs were evident, and where you see the risk level in the student. Ask about what the student's been going through at home. Has the parent noticed any changes in the student lately? Also reviewing next steps. So if you've gone through the interview and you have a relative concern that may warrant crisis intervention. It might be that parent contact is somewhat of that handoff to the parent. So you need to ensure that the parent is able to come in, is able to transport the student. So part of your role is identifying the capability of the parent to follow through with the next steps. And if there are concerns with that, do you need to reach out to other team members to ensure that the student can be safely monitored and an intervention can take place appropriately? We've also created a sample notification form. This is on our webpage, and it's pre-fillable, and it's just a way of documenting what's been done in terms of the suicide risk assessment. And if you're making phone contact with a parent, this might be a really good way to sort of structure what you share with a parent, because it offers that information. This was the description, these are the actions that we've taken so far, and what we're recommending in terms of next steps. You also want to get some of that contact information, or ensure that that contact information is correct. And we want the parent to acknowledge that they have received the information. We also included some links on there for parents. And it's really important at this time to educate the parents. Parents aren't always aware of what's important when their child is at suicidal risk. Particularly younger children, parents aren't necessarily going to take the threat seriously. So educating parents about what can be done at home. We've included some recommendations there about what to look for, maybe how to create a more safe environment at home by locking medications, locking guns out of reach, or any other methods that have been outlined in the student's interview.
Mm-hmm. And this parent brochure right here is one that I almost always gave to parents as part of it. It really covers a lot of information. So I encourage you to go ahead and print a bunch of those and have them ready to go so that you can hand them to parents. And then some of these other ones, like Martha said, are a little bit more targeted to maybe what the student disclosed during the interview. And one thing that I think we definitely need to mention as well is that the only time you would not reach out to family is if the student's risk of suicide was associated with any type of abuse. In that case, you would go ahead and connect with Child Protective Services.
So when we're making contact with a parent, we might do this in the presence of the student, but we might do it separate from the student if we think that that might result in a negative outcome. So we always want to make sure that that student is supervised until the parent or guardian can provide supervision.
Mm-hmm.
As part of that documentation and notification, we want to make sure that we're sharing any community and emergency resources, hotlines, any information that the student or the family might need to access when they get home. And we talked about educating families about reducing lethal means. And Sarah also mentioned that if the student has indicated that their risk of being at suicide relates to parent abuse or neglect, then we need to notify social services instead of the parent. Mm-hmm. This happens very rarely, but it does happen in some cases, and that is in the Code of Virginia, and it's important that we make that clarification.
And so I've had some situations before where a student is really reluctant for me to call, and I always am honest with the student, because you don't want to tell them something and then do the opposite, because there's that trust that you lose. So I'm always honest, and I share, yes, I do have to connect with your family about this. They need to know. And there's that fear that they're going to get in trouble. And that might be a really real fear. And parents are very afraid when you make this phone call. And sometimes, you know, as a parent, when we're afraid, we react not necessarily the correct way. So I think part of this contact can be actually instructing the parent on, hey, you know what, your kiddo is actually really afraid for me to disclose this to you because they think they're going to be in trouble. So let's make sure that when we, when you are connected with your child, can we talk about how that initial connection needs to be? I know that you love your child. I know that you want your child to feel comfortable talking to you about this. I know that this is what you want. So can I offer you some suggestions on when you are reunited with your student, your child, how that initial interaction needs to be? I think parents are appreciative of that support. And sometimes it's great to provide them with that explicit direction. And you'll hear, I'm sure that many of you who have been through this before can relate. Some parents are initially really angry and upset with even with you for making the phone call, and allowing them and listening to them. We're also kind of in this moment being a counselor or support person for that parent. And we have to recognize the moment and what they're experiencing. That's a huge piece of our role.
I think along with that too, what some students aren't aware of confidentiality and what the rules are surrounding confidentiality. It might be a student that we've worked with and talked to several times, and all of a sudden they disclose something, and that they've known that our conversations have been confidential in the past. So it's really important that students understand that yes, our sessions are confidential, but when you express to me a concern for your safety or the safety of someone else, I have an obligation to report this. So it's really important to make that clear to students so they don't feel like you're going behind their back or you're betraying their trust. And unfortunately, sometimes with some students, it's difficult to repair that relationship after you've had to disclose something, but it's really important that they understand that that is your obligation to do that.
Yeah.
And on this page are some more resources. And again, all of these are included on our webpage. There are some great resources about how to talk to your student when you're concerned about any kind of suicidal threats. I would point out the suicide in social media. This is something for a lot of parents. Social media is a brand new invention that we didn't have when we were teenagers. And so there are traps and concerns that lurk out there that many parents are unaware of. So I think it's really important to look at that. And along with that too is monitoring your child's social media. This is a really good way to navigate, I guess, sort of the experience that your child is going through, and really pay close attention. If you hear from your child's peers that maybe they're concerned about something your child posted, but really being aware of what's going on with their child's life. And I think that's, again, a piece of education that we can share with our families.
I agree. And that almost falls into that preventative piece too, is, educating our families on social media and how they can monitor it is huge. Students are really savvy and they use that as a great way to communicate with one another, but then also it's an outlet of their feelings and what's going on with them. So it's a great way, it's a great tool for us to kind of keep our finger on the pulse of how students are feeling, but we have to be able to access that. So arming our parents with that information is a great suggestion. I'm glad you highlighted that. And I think thinking back to when I was in the field, one of the things that we did as a school-based team was we had a folder. And on the left side of the folder, we had all the forms and documents that we needed to go through the process. And then on the right side of the folder, we had supports. And I had one section that was supports for students, and then another was for supports for families, so that I could I wouldn't give necessarily a family all of these supports. I would, like Martha said earlier, pull out the ones that were pertinent to the situation, but I had them ready to go. And then in the student support section, I had, you know, some, especially because sometimes kiddos are going to have to wait. So let's say that the student, I'm going to make that phone call and the student's going to go into another room with another counselor or another staff member and wait for me to return. Giving them something to do was always something important. And I didn't want to just have them go and sit and just, you know, that's a really difficult 20 minutes, right? So I had worksheets that they could color in there. I had word searches. I had I had some magazines so that I had something to give to the student while they were waiting for us to gather some additional information, and just to keep them calm and comfortable as much as I could. So that's another thing that you might want to consider including in that intervention folder that you might be creating as a team. Okay, so a big piece of the intervention is gathering a lot of information, which we've sort of talked about already. Is, you know, your student interview is a huge piece of that, but you're also interviewing classmates or peers and teachers and family members. That's all a piece of this. You know, I can't tell you how many times I would interview a student and I would think that their risk level was one thing, but then I talked to the parent and it changed everything. Because I'm learning more. Or I talked to a teacher who works with that student, and the teacher shares with me something, you know, that happened a couple weeks ago that elevates that risk or changes that risk. Or maybe it actually makes me feel better because, and lowers the risk because I learned about some protective factors that are in place. So at those, you know, connecting with those folks is such an important piece of this. I will say that when you connect with peers and with teachers, discussing with them the confidentiality pieces around that and making sure that you don't over disclose anything that isn't necessary. You know, you don't need to say to a teacher that you're conducting a suicide risk assessment necessarily. You don't need to share that with their peers. It can be, you know, and really the peer conversation should only necessarily happen if the peer is already aware. So for example, if the peer is the one that reported it, or the peer is the one who overheard the student say something, that's really the time where it would be appropriate to have a conversation with a peer. But gathering that information in a confidential way is really important. And then additionally, looking at the student records. So we want, and this is where your school administrator can be a huge help, is they can gather this information to assist as well. You know, pulling that attendance, discipline, clinic records, if they have an IEP or 504, and then also looking back to see, have there been any other risk assessments that have been conducted in previous years, perhaps, because if we see a pattern that can elevate a risk. The clinic records is one that I think is so important as well, because maybe this is a student that hasn't frequently visited the school counseling office, but if they're going to see the school nurse every week on a regular basis, then that's an indicator that there really is something else going on with this kiddo, and it's been going on for a while. So don't skip past that. Your school nurse is a vital piece of information and can oftentimes share stuff with school teams that they wouldn't know otherwise. So be sure to tap into that as well. So, and then that consultation piece, you know, we said this at the beginning of the last module. This is not the responsibility of one individual. So this should be a team approach where people are coming together to discuss everything that's been gathered and to determine that risk level as a team. It's not something that should be shouldered by just one individual. So this is another sample form, again, we've created that could be useful to your team. It's a documentation form where you're just going to be inputting all of that data that we've just kind of talked about. Just wanted to bring your awareness to that as well. So then we're going to determine the risk. And again, the guidelines have a suggestion language around this, but if your school division has other language for describing risk levels, that is absolutely fine. But these are the ones that we have in our guidelines, where it ranges from there's no risk at all to it's an imminent risk. And imminent risk is, I'm going to go ahead and start at the most significant, is where it's a clear present risk of threat. You know, the student has a plan. You're pretty sure that that's going to be carried out. They have the means to do it. That's where you're going to be having that immediate intervention. You're probably going to be pulling in some community resources. The team's going to be acting quickly to support that student. And then and I'm not going to go through each and every one of these because I know that you're professionals and can read, but then if we go all the way to the other side where there's no risk, that's where we're going to be talking about, you know, those suicide risk assessments that start out because a student says something, but it's misinterpreted, or, you know, they were just joking and you've investigated it and you realize that there really is no thought around suicide, or there's no suicidal ideation at all. It's just kind of a misunderstanding or, you know, something that was taken out of context. So think about however your school division defines the different levels of risk. Make sure that you've talked through them with your team and that you feel comfortable with those different definitions and how they're explained. And note too, before I forget to say this, that the level of risk is somewhat flexible. You know, I might say that after the student interview that I'm thinking the student is at a moderate risk, but then after we've gathered more information, we realize that actually it's a high risk or it's imminent. So know that it's not necessarily something that has to be stagnant, but this is where we're heading. We're trying to figure out the level of risk, because the level of risk is going to be associated with the level of support that student gets. So again, when we're determining that risk, it's really important if you're kind of in between, you're like, oh, it could be low, it could be high, I'm not sure. Go ahead and go with the higher risk level. Better to err on the side of caution than not. And the other piece is too, is during the threat assessment or the suicide risk assessment process, you might recognize that it's turning into a threat assessment as well. And what I mean by that is sometimes a student might be referred for suicidal ideation, but then as you are starting to go through this process, you recognize that there's also a threat to harming others. And at that time, your team dynamics might change a little bit, and you might have to pivot to be able to assess both threats simultaneously. So making sure that your process is fluid enough where that can occur. And that speaks to also being able to establish those clear communication paths that protect student confidentiality. So, you know, one example I have for that is you're not necessarily looping in people that are not necessary in the process. So for example, one of my schools, one of our communication paths included going through our front office secretary and making sure that and asking her to help us locate the administrator. Well, what we realized was that was not a necessary pathway. And that just brought in one more person that was kind of in the know of something that didn't necessarily need to be shared with them. And so we cleared that up and we changed it so that, you know, I was able to get directly in touch with my administrator in a different way. So thinking about that and thinking about, you know, if you walkie your administrator and they don't answer, what's the next step? And just making sure that you have cell phone numbers and, you know, all those tools that kind of at your fingertips so that in that moment you're not scrambling to get what you need.
So next we're going to talk about safety planning. And safety planning can occur at different points in this process. For some students, if perhaps they're at low risk, you might create the safety plan at the same time that you're doing the interview or the same day, and you feel relatively certain that the student's going to return to school the next day. You can do this if the student goes to perhaps an inpatient or outpatient facility and you don't expect them to return for a while. You might be doing the safety planning prior to the student returning to school. So this can be done at different times. But really what you want to include here are the warning signs that the student identifies that this means that maybe they're starting to get into trouble again, that they're starting to go down that rocky path of suicidal ideation. And also the coping strategies that the student can use. And what's really important with all of this is that this should be student-led. You really want the student to be involved in this process because everybody's got different warning signs, different coping strategies. And so we really want this to be individualized to the student and based on the student's needs. How do they build protective factors? What areas do they need to focus on, or what areas do we need to help support to build their protective factors? Hopefully every student is going to have somebody within the school that improves their mood or uplifts them, or is somebody that they can talk to. And so we want to try to identify those personnel or other students that might be helpful if the student starts needing a trusted individual. We also want them to know who they can contact. If they are on the bus home, for example, and don't know that they're going to get off the bus and make it inside without something happening, they need to know who they can contact in an emergency. And then the steps that the student can take. What do I do? Where do I go if I become suicidal at some point? Again, we want to share resources with the family, and we've identified a case manager. And that case manager is going to be the one that's really going to be the one in the school building that's going to monitor the student as they return from whatever situation they came from. So we did create a sample safety planning form that can be helpful in driving this process and this meeting that you all might have within your schools. Again, it can be used at different times within the process, but it's really important when students have gone through a suicide risk assessment that there is some type of safety planning in place, because we don't want to lose sight of this student, that if they were in crisis once, it's very possible that they could be in crisis again. So this again is similar to the other documentation forms that we created. But this time we're talking about, what are the things that help me? What are the things that improve my mood? What do I like to do? What, is, if I can take a walk around the school building, does that get my mind off of what I'm doing, what I'm thinking about? Also those supportive people around them. And then the warning signs that I am not doing well. We also, again, want to identify those trusted adults that the student will seek out if they're having thoughts of suicide that he or she are having trouble managing.
And I would say it's important to have trusted adults. You really want to encourage the student to think of someone in the school setting, but then also someone outside of the school setting as well.
Absolutely.
All right.
So the last section that we're going to talk about may be something new for some school divisions. And this is a conversation that we're really having across the state right now with several different groups. And it's the idea of returning to learn after an extended behavioral health absence. And we're really encouraging school divisions to have policies and procedures for holding a reentry meeting for any student returning to school following a mental health crisis. The meeting should be scheduled prior to or on the day of the student's return to school, which may depend on hospitalization or other interventions. During the meeting, the school should either revise or create the safety plan. The reentry meeting must include the assigned suicide risk assessment case manager that we've identified, as well as an administrator, because the administrator is really the one that can support the interventions that we want to put in place for the student. Additional team members certainly would include the student, any appropriate family members, any appropriate suicide risk assessment team members, as well as any out of school or community mental health care providers. We always want to encourage that communication between our community providers and our school personnel. And the purpose of the meeting is really working towards identifying and addressing the issues that led to the crisis and
Mhm.
build a strategy to prevent reoccurrence and not getting to that crisis situation. We want to identify the needed supports for the student and ensure safety for the student. If the team suspects a disability because of what's occurred, the student should be referred for a Section 504 or to special education for consideration. Example of potential supports for some students might include modifying the student's schedule, as well as their course load to relieve stress. What we know is students that have been out for a behavioral health crisis are very likely to be behind in their schoolwork. They're going to be stressed. They're going to be concerned about potentially what their teachers and their peers are thinking about them. So we really need to put that consideration on the table when we talk about what is going to support the student. And again, it's going to be very different for every student. We want to work with teachers to
That a little bit. That's like such an important point that you just made about students being afraid to return and what, you know, kids are going to ask them, where have you been? You know, and it's an innocent question. But if we don't prepare our students on how to answer that, they could be caught in a really difficult situation. And there is no scripted answer, right? It's going to depend on that kiddo, what they feel comfortable sharing, you know, but helping them to go ahead and develop an answer, and then also sharing that answer with other folks that might be aware of where the student was, so that if a teacher is asked, where has so-and-so been, they know how to respond so that it aligns with how the student is responding. You know, that's just one of those things that can alleviate so much stress and anxiety for a student as they're returning back into the school setting. And it sounds like such a small thing, but it's so huge and something that we can do to bridge that return in such a beautiful way. And I wanted to say too, before I forget, you know, we've been talking about that folder or that binder that your team has. Another thing that's a great addition to that is the release of information form that your division has, so that if you are going to be pulling in an outside provider into this, you go ahead and have that form ready so that you have that that release signed so that you can communicate directly with that provider. So sorry to interrupt.
No, great information. And the other, I just want to touch on the fact that I think a barrier to this in some divisions is the unawareness that we have students out for behavioral crises. And so if there's ever family outreach, community outreach, this is something that you really want to talk to your families and communities about. If you have a local community services board, let them know that you're engaged in this process and that you really want to be a part of addressing the student needs when they do return to school. Because the more that our community providers are aware, the more that they're able to share with their families that we actually have this support available to our students, because a lot of times families aren't aware that we can be there to help support them as they transition back into school.
Martha, you just made me think of another really great thing that we were able to do at one of my divisions is, you know, there was a place that we would send students typically that was, you know, associated with one of our local hospitals. And for a long time, I would just, you know, tell the parent, this is where you should go. And I didn't necessarily know what happened when they got there, what that looked like, what that process was like. And so one of the things that we did as a school team was we connected with that community resource, and we said, hey, when we are sending families to you, what does that look like? And we were actually invited to come and tour the facility, walk through it just like we would if we were a parent walking in with our student. What would they experience? And it really made me feel better as a professional to be able to speak to that process more knowledgeably, to actually be able to speak and know people by name that they might be interacting with. It really helped. And then we were also able to streamline some of our forms. So I said, you know, we were able to say, well, this is the information we collect. How would you like us to share that with you? What release do you need from us? What release do we need from you? You know, and we were able to, you know, we were talking about clear communication paths within the school, but also having clear communication paths with your outside providers is huge as well. So sorry to interrupt. I won't do it again, I promise.
No, that's such a great point. And, you know, it makes for a great field trip. I will say we've, in my community, in the school that I used to work in, one of the schools I used to work in, we made those visits too as a team. And typically, now sometimes we have students that go greater distances outside of our community, but there's so many times that there's a really limited number of places that our kids go. And so it is really worthwhile as our suicide risk assessment teams to really make those connections and to collaborate with those outside providers because it's all about supporting the student, and communication and collaboration is really the key to that.
Yeah, and resource mapping and making sure that you are presenting parents with more than one option. You know, there's a lot of different, depending on where you live, but there's most likely more than one place that they could go. And so, you know, having a couple different options and being familiar with them is going to be really vital and important in that work.
Absolutely. Well, we thank you all for joining us for part 2, intervention of our suicide prevention web series. And if you have any questions about suicide prevention, intervention, and postvention, please look at our VDOE suicide prevention webpage. You're welcome to contact myself or Sarah Bazemore within the Office of Student Services. And we hope, if you haven't watched part 1, please watch that. And please join us for part 3, which will discuss postvention. Thanks so much.
Thank you.